You're watching the PIX 11 Morning News.
Yeah, Dr. Spencer's case really is triggering widespread concern among a lot of New Yorkers.
Yeah, Dr. Steve has been with us all morning long, helping us understand how the latest case will impact our lives. Well, joining him now is Dr. Nancy Simpkins, who is the medical advisor for the state of New Jersey. Good morning.
Thank you for joining us.
Thanks
for having me.
Okay, so you are the expert, so let's just let's dive into this right now. A lot of people, they heard the news last night, they're waking up, they're hearing the news now, and they're thinking, okay, where have I been? Have I been where this guy's been? Have I been on the train he's been? Have I been in that bowling alley? How concerned should just regular New Yorkers be, even if they were in these places where this guy was?
Right. So, of course, our job is to separate fact from fiction and to tell New Yorkers that there is no need to panic. I understand that's easier said than done if you were bowling on the next lane. But let's talk about Ebola virus and how it is transmitted. It is not transmitted the way influenza is transmitted. If this man was sneezing or coughing on you and, oh, I got the flu from him.
Sure.
It doesn't work that way. He would have to have copious amounts of vomit, which we know he did not have at the bowling alley, for you to be even remotely contagious.
So even if, say, he's bowling and he's sweating a little bit, and you touch the bowling ball that he used to bowl with and a little bit of sweat, that's not going to get you sick.
There has not been a case of transmission, what we call a mystery transmission, ever since 1976. It's all known transmission from sick people with bodily fluids and specific bodily fluids, and sweat is not really one of them.
Okay, so I want to be very clear. So what are the bodily fluids? Because saliva, you're saying, is not one?
No.
Okay, not saliva.
Right.
It's not sweat.
It's blood.
It's blood.
It's vomit.
It's
and
diarrhea.
That's correct.
Cool.
Yeah.
Okay.
Now take us back to the beginning. So he's coming from treating these patients over there in Guinea, and then he comes here. How does this happen? I mean, shouldn't he be quarantined over there before he comes here? How does this happen?
Okay. I don't think that's necessary. I think that's overkill. You know, to say you're going to take everybody from West Africa that comes to this country and quarantine them for 21 days, it doesn't really make a lot of sense. What he did was he was monitoring his condition. He was aware of the signs and symptoms. He was taking his temperature twice a day. And really, by the time he got sick, he made the call. And so I think in that case, it was the proper way to go.
I think also we have to remember that this man was away from his job at Columbia Presbyterian as an emergency room doctor for many weeks. So now to quarantine him for another 3 weeks is just not a practical situation. The question lies Wednesday. That is the key day, right? We're all trying to decide as medical professionals, does his fatigue translate? Should he have had a red flag? But this is
that was even Tuesday he started feeling fatigued.
But this is an emergency room doctor who deals with Ebola for weeks. He knows he would not knowingly put anyone at risk. So you can be sure he was checking his temperature. And remember, although there is great panic out there, Ebola is tough to catch.
Yeah. So tell me this. I understand your point that this guy is an ER doctor. You're taking him away from his life, away from his job, where he's saving lives, right? So ultimately, taking him out could potentially hurt lives as well if he's not sick. But at the same time, I mean, if somebody has been working with people who have Ebola, I mean, it's not just you've been in the country, but you're working with sick people. Should the protocols be changed, or do you think everything was done correctly this time?
I think Doctors Without Borders is looking at this very closely now. They are clearly going to be reevaluating what their recommendations are. They are a phenomenal organization, as we all know. They do great work. So they too have to work with the CDC and the new Pentagon team and decide whether they are going to change up their guidelines for doctors and healthcare workers that come back to our country. Should they have a 21-day quarantine? That will be the big question that's going to come out today, I think.
Yeah, but it still brings us back to the point that even if he was feeling fatigued on Tuesday and then Wednesday, you know, again, if you're not in direct contact with bodily fluids like vomit and diarrhea and blood, you're not going to get it. So people say, oh, he went for a jog or he went to the bowling alley. Nobody's going to get sick from that. Because they haven't come in contact with his fluids, and he wasn't highly infectious at that stage.
But is that a wise decision? I mean, I think is that a wise decision? Because look, we've been talking about this off the air about how quickly this all went down. This guy started to feel fatigued on Tuesday, and then by the next morning, he has a 103-degree fever, and he's feeling nauseous and diarrhea. I mean, this thing it seems like it happens very quickly.
That's how it does work. This virus works exactly like that. But let's go back to Thomas Duncan and the 42 people that he was in close contact with. Not one tested positive. Just the 2 nurses who were in contact when, remember, the sicker you are, the more virus you spread. So as the patient gets sicker, they're spreading more and more virus. So his household contacts who had very close contact with him.
And his fiance,
exactly,
didn't have it, so.
Exactly. So we as American people and New Yorkers, we really have to stop the panic and just look at the facts.
And one of the reasons why it was spreading so much in West Africa is because as part of their culture there, they wash people before burial. Right. They come in very close contact with people. So that was causing a crazy spread. You can't expect that to happen here.
All right. Dr. Steve, Dr. Simpkins, thank you so much for your expertise on this. And by the way, if you have questions about this, you want to weigh into the conversation, ask Dr. Steve questions, please go to our Facebook page right now. It's PIX11.com or actually Facebook.com/PIX11 News. You can actually also tweet him. Tweet a question at PIX11 News. We're going to be answering your questions at 8:30.